Dear friends, I am Dr. Bose. I am the founder of Saans Foundation, and today I must tell you what is our differentiator in Saans Foundation and what are those things we are doing differently which is helping our patients to recover faster. We believe in this decade of chronicity of diseases, the most important thing which can play a very important role in reversal of chronic diseases. That means there are certain areas in a disease state we can revert it if we follow certain rules. And what are the rules we are following here? The first and foremost thing, after a detailed evaluation of the patients, we try to educate them. The patient education is the most important component at Saans Foundation. Every patient is educated through an image and an audio, and it is sent to their phone. Through our WhatsApp patient education tools, we are providing each and every information about the patient's detail, what are the do's and don'ts, how to take the inhalers, what are the things they should be doing it, what are the triggers and how they should go about it. Then we try to explain them what exactly the disease we are treating, whether it's an allergic rhinitis or it is an asthma or COPD or tuberculosis or interstitial lung disease or pleural effusion, yes, yeah, hypersensitive pneumonitis or some cardiorespiratory problems, or whether it's a sleep apnea or lymphedema, whatever the common diseases we are treating, we are very specific through our patient education tools. After we have educated the patient, then we do a detailed evaluation. And after a detailed evaluation, we give them a written action plan. Now, what is a written action plan? We give them, so look, this is the way you have to treat yourself. And not only that, we talk about treatment, we educate them, we skill them so that they can take care of themselves. And the very important thing which we are finding it, which is making different in our patient care treatment program, is that we not only talk about the drugs and delivery systems, we also talk about the mental health, the nutritional health, the emotional health, the social health, the environmental health, the spiritual health. Spiritual is a state of mind, how patient is feeling good about it, how he can park himself. So we give a very 360-degree program, and our concept is we treat the disease as a whole, not as a hole in the body. We don't see only the disease. We see a very holistic approach. And in a holistic journey, we address a lot of things. And very important thing which we are realizing here, especially in post-COVID scenario, the mental health is playing a very important. We teach them how to become mindful from mindfulness. That means how they can declutter their mind, because every disease has a mind component, what we call illness. So if your illness gets converted to a wellness, which we use it through our different techniques and skilling techniques, significantly the disease perception and the intensity of the problems come down. So at Saans Foundation, we are very holistic in approach, and every patient is skilled. Through repeated patient education tools, our staff is very diligent. Each and everything, the compliance issue is addressed. Regularly, they are followed up with different WhatsApp messages. Yearly flu vaccinations, the pneumococcal vaccination, and other protective measures, they are yearly updated. They are educated through our website. Our website is a patient education, a kind of patient education tool. So basically, a repeated, recurrent patient education centric approach, skilling the patients, really making a difference. We believe in three important components when it comes to the chronic care management. The first is attitudinal change. The first thing is that we create an attitude in the patient, we give them the confidence, we reassure them, then we skill them. That is the second thing, S. So after the A, we skill them, and knowledge. Knowledge is a patient. So ask, attitude, skill, and knowledge are the key areas in the Saans Foundation. That is our differentiators. Then, of course, the patients are called in the next week after the treatment. And that is the most important phase. After they come over with us in the second week, that is the time our whole team, comprising of psychologists, therapists, our patient education team, they work on a holistic lung rehabilitation program. So our pulmonary rehabilitation program is very holistic, very tailor-made, very patient-centric, And each and every patient who have presented us with a chronic respiratory diseases, they are given a structured, holistic, bi-weekly, at least 6 weeks of pulmonary rehabilitation program. So dear friends, pulmonary rehabilitation program, patient education, skilling the patients, and create an empathetic approach is our whole concept. And we believe not in sympathy, but in empathy. And our strong philosophy is that we can bring a change with a chain. That means we create a chain among the patients. We can change their mindset. We change their lifestyles by creating a chain. A chain is created through our workers, through our therapists, through our team. That's why the Saans Foundation is able to handle different patients, and we are able to cater to most difficult patients, and the results are amazing. So dear friends, if you have any respiratory or pulmonary related problems, visit our website www.saansfoundation.com. Give us an opportunity to serve you better. I'm sure we help you to breathe better. Regards, Dr. Bose.